3?
So we've had a really interesting natural experiment in this country where the practice of cardiology, the Professional Society of Cardiologists, the American College of Cardiology, has tried to help define when angioplasty is most beneficial to patients and when it might not be. And they spent a long time building what we call the appropriate use criteria, where you could judge the benefits of angioplasty in different clinical scenarios as being very appropriate, meaning the benefits far outweigh the risks, may be appropriate, meaning we don't exactly know if it's beneficial or not and we need more research, or in some clinical scenarios where the benefits are probably small and may not be worth the risks. And what the American College of Cardiology did was to create these criteria, create a mechanism to collect this from every hospital participating in its national registry, and then provide feedback to those doctors participating at each hospital what proportion of their patients were appropriate, maybe appropriate, or inappropriate. And what we found and reported recently was after providing that information, there was a marked reduction in the proportion of cases undergoing angioplasty that were rarely appropriate or inappropriate. And that alone might raise some concern that the doctors were just upcoding or changing the patient's clinical scenarios, but actually we saw the volume of procedures decreasing as well, which suggests that really this benefit is attributable to doctors now treating medically patients they used to treat with angioplasty, presumably at lower risk, and preventing the unnecessary expenditure of money and resources to treat patients who don't benefit a lot. And we think this is a really remarkable achievement. I don't know of any other profession that has scrutinized one of the ways and treatments it offers to decide that some patients don't benefit and then take the necessary steps going forward to prevent those procedures being done in patients who don't benefit. And so we think this is a real step forward, and I'm actually very happy to have been a participant and very proud of my professional colleagues who have really led this initiative and driven it forward.